9:44. Welcome back with the live shot from Century Plaza Hotel and Spa. We're looking after your health and ideas on how to prevent a stroke from happening. Dr. Scott Lear, professor of health sciences over at SFU, joining us right now. Welcome to the show.
Thanks a lot, Ritas.
Looking at these stats, the stroke is the third leading cause of death in Canada. Staggering, and some of these statistics just kind of blow your mind. But what are the keys to reducing the idea of a stroke happening in the first place?
Well, a lot of it is actually modifiable or lifestyle related. There are 9 risk factors that can account for between 80 to 90% of risk of stroke. And some of them are things like blood pressure, cholesterol, diabetes, which lifestyle does have a role, but also medications can be involved. But others are like reducing stress, limiting alcohol, increasing physical activity, eating a healthy diet are some other things, and a healthy weight as well.
All of these risk factors you throw in, blood pressure is a really interesting one because you would think, okay, how do I treat this? Do I take medication or do I incorporate, as you mentioned, diet and exercise? What do you find is more effective?
Well, I would hate to say one's better than the other, because for somebody who has high blood pressure, you probably need to use all the tools in the toolbox. All the guidelines suggest for blood pressure, even lowering cholesterol, preventing diabetes, lifestyle as the first arm of treatment. There may be some people who have quite elevated blood pressure that a doctor may want to start them on a medication as well as lifestyle therapy. But usually, I've seen cases where some people who are actually taking blood pressure lowering drugs, they've increased their activity, eating healthier, they've lost some weight, and they can either be taken off or their dose decreased. So lifestyle is and should be the first line of prevention for high blood pressure and stroke.
And if we incorporate movement and exercise in our lifestyle, how many minutes per week and what type of activity are we looking at to have effective prevention?
Yeah. So the minimum guidelines suggest 150 minutes per week of what we call moderate to vigorous activity. So that's 20 to 30 minutes on most days. Now the key thing here is the moderate to vigorous. So getting up and walking to the water cooler or going up and down stairs in your home, that counts as activity, but that's not going to count towards your 20 to 30 minutes. If you're out walking, it would be approximate about doing 100 steps per minute, so just over 1 per second, which for a lot of us is easy to do. And the nice thing about the guidelines is that you can accumulate this over time. So it doesn't mean you have to set aside half hour. It could be that you're doing 10 minutes. It could be like if you take the bus to work, you get off a couple blocks earlier and get that 10-minute walk there. You get on a few stops later, get that 10 minutes there, and maybe after dinner. Now, as you're progressing, because those are the minimum, it's good to try to extend that time and do more, because the more activity you do, the greater the benefits as well.
And when we look at the idea of prevention, the ideas of symptoms, if someone is experiencing a stroke, I've seen some of these commercials, but please remind us some of the keys to look out for.
Yeah, so there's a great acronym called FAST. The F stands for face drooping. So you see like unable to smile in the face on one side going down. The other, the A relates to arms, so unable to raise both arms. It could be a person can raise one but not the other. The S is for speech, so speech is slurring or having trouble communicating. And then T is time, because time is important. The faster you get a person to the hospital who's having a stroke, the faster what they call the clot-busting drugs can be administered, and the less damage to the brain.
Number one thing someone could start to do today, tomorrow, to look after their health and prevent a stroke, what would that be?
So, number one, if somebody smokes, that would probably be the best thing to quit smoking. There's a lot of people who don't smoke, so being aware of your blood pressure and managing blood pressure through lifestyle, like being active, healthy diet.
Good tips right there. heartandstroke.ca/fast. You see the website on screen. Doctor, thanks so much for coming by.
Thank you, Reyes.
Great information right there. We'll take a break. Final